simple blood sample from the mother may identify a unique biological mechanism for autism. This test is performed by a laboratory regulated by CLIA to perform high-complexity clinical testing. From a technical standpoint, the MAR-Autism test is an in vitro assay that uses an ELISA for each autoantibody. This method is a well-established diagnostic tool and is performed on a plasma collected in a yellow top acid citrate dextrose ACD tubes from the mother. The MAR-Autism assay reports the presence of maternal autoantibodies at significant levels related to the following proteins: CRIMP1, CRIMP2, LDHA, LDHB, STIP1, and YBOX. All proteins expressed almost exclusively in the developing fetal brain. The presence of these autoantibodies, either individually or in specific combinations, indicates increased likelihood for maternal autoantibody-related autism in the offspring. The MAR-Autism test has been validated for women who have a biological child either diagnosed with or experiencing signs of autism. The test helps assess the likelihood of autism when a child showing early signs, or a mother has a child diagnosed with autism and wants to understand the risk to future pregnancies. The MAR-Autism test is a blood-based autoantibody assay that enables early behavioral therapy and/or targeted preconception counseling. At this time, the intended uses of the test are two general scenarios. For the mother with a symptomatic child, may shorten the time to diagnosis. Results may prompt earlier referral for diagnostic evaluation and developmental intervention, may provide additional context in unclear presentations or early symptomatic stages, may guide decisions around early therapeutic engagement, even prior to formal diagnosis. Positive test result makes an autism diagnosis 3.6 times more likely. For the mother with a previously diagnosed biological child, it enables more precise understanding of the likelihood of recurrence of autism in future children. It can inform family planning decisions and may guide decisions around early diagnosis and therapy in subsequent children. Overall, the MAR-Autism test helps empower families and their providers with actionable data to better inform autism care decisions and family planning. As with any test, its use and interpretation should be discussed with your healthcare provider within the context of the specific clinical history. MAR-Autism test is not a genetic screening test. It is a highly accurate way of detecting a heritable condition and informing parents of their likelihood of having a child with the MAR subtype of autism. Preliminary academic research suggests that MAR-Autism can result in higher severity of autism and increased co-occurrence of intellectual disability. The MAR-Bio test is the only test that can determine the heritability of MAR-Autism diagnosis in future biological child. The MAR-Autism test is highly specific, demonstrating specificity as high as 97% in clinical validity studies. This means false positives are rare. However, the test is not for everyone. This test is not intended to diagnose autism or for women who are currently pregnant, are interested in doing a general screening, such as women who don't have a biological child with symptoms or a diagnosis, or settings where autism affects a family member other than a biological child, such as a mom, dad, aunt, uncle, sister, brother. Test is also not for women who are younger than 18 years old or are a resident of New York State, as MAR-Bio is pursuing licensing in New York State at this time.